Hello, this is Aaliyah Sherrod of the Millionaire Ladies Mob. Thank you all for joining us this evening. We are going to talk about something that's very interesting and that I absolutely love. And I think there's a lag in my video, but that's okay. You get the point. We're going to talk about annual open enrollment. And because there are two concurrently, we're going to go over the people under 65 first, and then we're going to talk about those that are in Medicare. And so, with that said, that sets the stage for our conversation. We're going to have Carmen Bernard. You can reach Carmen at Carmen 10K, and I'm Aaliyah Sherrod at Aaliyah 10K. Saran is not here tonight. She's got something else she needs to do. And so it's going to be me and Carmen, but this is going to be a great show because we're going to talk about something that's so important. And it has a timeline. There is a timeline. So I want to make sure people understand how important health insurance is. And the reason it's important is because if you get sick, you don't have to worry about how you're going to pay your bills. That is the most important thing that your family can have today, alongside other things. But health insurance is very, very, very important. And the reason it is because if you walk into the doctor's office, the first thing they ask you is, can I have your insurance card? And as you grow older, you want to go to the doctor more often, take your physicals, make sure that you're taking your wellness exams. So we're going to go over what open enrollment is, when it started, and when it ends for a lot of states. States are all different. So Carmen and I are both licensed in tons of states. So it doesn't matter what state you're in, we could help you. Okay.
That's right.
So, Carmen, did you want to say something about? No, not yet.
Well, no, I'm excited about this conversation tonight because it is staggering the number of people that are going without health insurance. And sometimes they're going without health insurance because of lack of information or misinformation. And so if you're here with us tonight, please share the video, give us a like, a comment, share the video, subscribe to our YouTube channel. This is super important that we get this out to as many people as possible. We're, as Aaliyah said, we're going to be talking about two different things. We'll talk about the under 65 health insurance, as well as Medicare, which is mostly over 65, and some others. But this is a time that you should know what you can do, what are the rules, and see if you can qualify, because this is the time to jump in. This is open enrollment, and this is the time that you get in without having to have a qualifying event, without having to have, you've lost your job, or you had a birth of a child, or moved, or something like that. This is the time that you get to jump in. Everybody gets to jump in at this time without that. But we're going to talk about some people, and some circumstances, and this could apply to you, so that's why you want to listen up tonight.
Right. Great. Great, Carmen. Thanks for that. So let's talk about when open enrollment started, because it has been going on for about a week or so. So November the 1st, open enrollment started for 2023. What that means is right now you can find an insurance policy or health insurance plan for your family that would go into effect January 1st, 2023. Now, there are some special circumstances.
So let me ask you a question.
Yes.
You said open enrollment started November 1st. Which one are we talking about? I know
We're talking about under 65.
Okay. So this is typically open enrollment for people that are under 65,
right,
and it's for healthcare and what is called the Marketplace or Affordable Care Act, or most commonly called ObamaCare. Obamacare. So we want to make sure you understand that that's what we're talking about right now. You're under 65. You do not have any health insurance, either because your job doesn't give any health insurance. And a really exciting part we're going to talk about, your job does give health insurance, but it's so super expensive that you can't cover your family. So you can only choose to cover you, or you just decide not to take it at all, right? And so if that's you and your circumstances, listen up. But again, this is for the Obamacare Affordable Care Act marketplace insurance is what we're talking about.
Great, great. So what Carmen said, so open enrollment started for under 65 November the 1st. But there was, prior to that, what we called a special election. And what happened is that President Biden created, I guess I can't think of the name of it, but back in March, it allowed for people who had income levels under a certain percentage of the poverty level. So that created an open enrollment for those people that could get health insurance. And we utilized that a lot. I had clients who didn't think they needed health insurance, and then they found themselves in certain situations, and we were able to use that because their income went down or they lost their job. That is what we call a qualifying event. So that was called a special election. So what we're talking about now is where anybody can enroll in a plan as long as, again, you don't have group health insurance that is affordable. And that is the key word, which is affordable for you or your family. There is a percentage. And what that was, it was called the family glitch. So when we would talk to clients and their company offered them health insurance and they were paying, let's say, $50 a week, which was way less than I think it was 9.85% of their family income, they could not enroll in a health market or marketplace plan and get a tax credit or a subsidy to help pay the premiums. That went on from the beginning of the Affordable Care Act. That was a rule in the beginning.
So yes. wait. So wait. If I'm on, explain that. So if someone's job was giving them insurance, and as long as that insurance for them, not for the family, just for them, was under 9 point, what did you say?
I think it was 9.6. I don't have the exact number. 9.6.
So as long as it was under 9.6%, that means in the government eyes, that is affordable, and you cannot go get insurance on the marketplace.
Right. Even though your family might be paying $2,000 a month.
Right.
Because they're your family.
And typically that's what happens, right? The insurance for you is typically not a lot of money. But when you try to insure a spouse or children, that's when the problem comes, right? I remember, you guys know that I worked for DeKalb County Schools of, as a teacher for the county in Georgia, for one of the counties here in Georgia. And when I started, employees didn't pay for health insurance. Mine could be totally free. And I only paid if I then brought like my husband and our children. And so what did I do? Because my husband already had insurance and he covered the children and he even covered me. I still took it. I was like, okay, in case that doesn't pay something, maybe I'll get the rest of this, because I didn't have to pay anything. So, and a lot of times that's what happens. A lot of jobs it's not that you don't have to pay anything. However, it's way less just for you. But when you have to try to do your family, now it can be some crazy amounts because you're paying $800-900 a month.
Right.
Instead of $100 a month.
That's right. And so so we have two things going on here. In April, there was what we call the American Rescue Plan. So it allowed you to enroll if your income was under 150% of the federal poverty level. That's number one.
How do people know? How do they know?
Oh, their income charts. I can go over the income charts in California. There's so many things that as an insurance agent we have to know, we have to look at, and we have to understand. And each state, is different. There are so many rules and guidelines. It's not just picking an insurance plan and running with it. You can get a plan if you want and pay zero premium or $10 a month, but you had to be under 150% of the poverty level. And sometimes that could be like about $1,200 a month, something like that. I won't give any actual numbers, but there is a calculation. There is a federal income chart that we go by. Hold on one second. I'm going to cough. Sorry, I didn't want to cough in the microphone. But there's a chart. So that was the first thing. Then November the 1st, we had been hoping and anticipating that the family glitch get fixed. Every year, we hope and we pray that the family glitch is fixed, because there are so many families that cannot afford to put their kids and their spouse on a plan because it's too expensive or it's taken up so much of their paycheck. So now, as of now, if your premium for you, and then there's also a calculator that we have to go to and go by, and we have to ask a lot of questions. What is the premium? What's your annual income for your family? We have to go through a lot of things in order to find out if your family can get subsidies. But it's really easy to us. It's just we want you to call us so we can make sure that you get all the subsidies that you can. So
Right.
that family glitch saves a lot of people, about 5 million they estimate, but I think it's more than that. They say it's about 5 million families, but I think it's more than that, because it's 9.61% of the income of the family. That premium for just that individual couldn't be more than that. Now, most employers are going to pay most of the premium. We also have other opportunities for employers, and we'll get into that another time. Where
Yeah,
Go
I
ahead.
actually put it on there today. I was like, listen to us. If you have W-2 employees that you are paying for their health care, you want to listen to us. And we will do another show on this. However, the minimum takeaway I want you to leave with is, if you have W-2 employees that you're paying a group health plan on, you might be doing a disservice to your employees. They may be able to qualify for subsidies under the ATPC, the tax credit. And you can now redirect those dollars that you were using for the group plan to help them, to give them even more benefits, right? Now
Yeah.
you have a reason for your employees to stay with you, because you're now covering additional supplemental benefits, and they are now reduced their health costs, so that uh so now you're not paying as much, and they are able to cover their families and all of that. But listen, you have to call us to talk to us about that, because it's not just that simple. There's some other things that have to happen. And if you have what is it, 50 or less employees?
Oh yeah, 50 or less
50 or
employees.
less employees, you have to
Mm-hmm.
call us, because there's certain things that we have to do.
Right, right. And it's so exciting right now to be in the healthcare industry, because now we can help a lot more people with their health insurance. So let's
Yeah.
get back. Let's go back. We always just kind of go off a topic, but it's still health insurance related, because
Yes.
we help employers too. Okay. I'm going to be presenting to an association tomorrow, actually tomorrow, about that particular way to help their employees with insurance. And so it is becoming more prevalent. And there are things that, as an employer, that you can do. And if you want to reach out to either of us, do that. So let's go back to the open enrollment. Okay, so November 1st, some states, the open enrollment is from November 1st to, I believe it's January 15th. Some is January 31st. some would be February. So there are different states, different rules, different regulations. So you have to be mindful of your state. You have to make sure, whatever state you're in, that if you are in a state that the open enrollment ends December 31st or January 15th, that you make your choices before that time. Otherwise, you would have to have what we call a qualifying event, or if there is what we call a special election. And some of the special elections now are these the catastrophes that are happening. You know, the flood or the hurricane or earthquake. Right? I mean, all those things can create. COVID created an SEP for some states too. So there are
Mhm.
so many ways for you to get health insurance. There's no reason for someone not to have health insurance. Okay. There is absolutely no reason. That be in 10 years ago, you knew you had to have health insurance. There was nothing. And the prices to me are still about the same. I won't say that, the Affordable Care Act reduced the prices, because I remember still paying almost the same amount of money that my employer was paying for me and my family that I'm paying now. And as you grow older, your rates go up. So it's still the same. It's not that big of a difference. And every year they went up. So there was really no change. Insurance policy premiums go up every year. So that to me was not something that was a big deal, because I knew I'm going to have health insurance no matter what. Because my husband was very ill. When you have children, you don't know what's going to happen to them. They can fall, hurt themselves. They do things. They bump their little heads. There is a respiratory illness going around, and there are kids that are just inundating the emergency rooms of the hospitals. And don't go into an emergency room without insurance. You just don't want to see that bill when it comes.
Yeah.
So open enrollment is now. There are some things you need to do. We need to know, there are things we have to know. Okay, so first of all, we have to know how old you are. So we need to have your date of birth, where you live, because plans are available where you live. It's not the same plan for Georgia as it is for California. And when you are looking for a health insurance plan, my thing is, you look for, if you are concerned about copays, that's not too much what you should be concerned about. Now, when you're working for an employer and they're giving you the choice of, do you want a $10 copay or a $20 copay or a $500 deductible, or a $250 deductible, because they're paying a big portion of it, then I understand that. But when you're shopping on your own, you want to sit down and think about what you're buying and what to me, your worst case scenario is. And the reason I say that is because if you are a user of insurance, so let's say you go to the doctor all the time, you are sick, you have problems, you have eye infections, you have this infection, you have that infection, you get really sick, you have bronchitis, you have a chronic illness, you have asthma, things like that. You look at your plan, and the low copay plan is going to cost you more per month. Now, a higher copay and a higher deductible will cost you less per month. Also, we think about HMO and PPO. What's the difference? Well, an HMO is what we call the Health Maintenance Organization. That's an HMO. You have a primary care doctor. Your primary care doctor takes care of all of your medical needs. You go to your primary care doctor, you get a referral if you need to go see a dermatologist, if you need to go see a heart specialist, if you need to go anywhere. And that doctor has to be in the medical group, unless the doctor gives you a referral to some specialist that's not in the medical group. But as long as you have that referral, your doctor, because that medical group is now responsible for the bills that happen. That's why you can get denied a referral if you want one. You say, I want a full body scan. I don't want just to take an MRI. I want a full body scan. But they're going to say, why? Why do you need a full body scan when, your head hurts or something like that? So you want to make sure when you have an HMO, there are guidelines that you have to follow. A PPO, which is a preferred provider organization, has normally a larger network. You have in-network benefits and out-of-network benefits. And believe you me, I've had a PPO for a couple years now, and I still trip up the same thing. I'll call a place and ask them, do they take so and so? And they say, yes, we do. And I go and I get there, and it's like, oh, shoot, they were out of network. Yeah, they'll take my insurance, they'll file the claim, but they're not in network. So the key word is, are you in network with this particular company?
And
Have
you
you
know
had
what's
that happen
the
to you, Carmen?
Yeah, and you know what is important here for people to understand, basically the difference between an HMO and a PPO, right? So in HMO, you have to go in network for everything. You go out of network, they're not paying. The only time they'll possibly pay is if it was really and truly an emergency and you were away from like your home place or whatever. Otherwise than that, they are not paying if you go out of network. It will be your bill. Okay. With a PPO, you have an option of going to in network or going to an out of network. But when you go out of network, that cost may be higher or they may not cover it. It's all going to be on you. So the PPO, it just gives you the opportunity to have more options. But let me ask you something. When was the last time that something was going on with you and you needed to go see a specialist? Did you go? How did you find that specialist? Did you look up in your head? Did you go in the Google, or did you just go in the phone book, or did you ask your doctor, who do you know is good? Who would be a good person to go to? That's what typically most of us are going to ask our doctor, who's a good person to go. So we're still, even though they're not going to write a formal referral, we'll still relying on them. So why pay more for what? So if that's a concern of yours, that's one way to minimize costs by going with the with an in-network with an HMO. But
Right.
the PPO, of course, like for instance, if the HMO, no one can see you until whatever, when you have the PPO, then you have the option of going outside and paying for that privilege.
Right, right. And you know what? You're right, because when I had the HMO years ago, I still had no problem getting to see a specialist. My doctor would give me a referral; it would not be a problem. But when you get a little older and you have different needs and you have specialists that you want to go to, then a PPO may be the way for you to go. But the PPOs are more expensive, and depending on the plan design. Now, when you sit down with an agent, you have to understand there are tons and tons of plans. The designs are all different state by state. So, where the premium is zero and you have an HMO with a very well known company, look at the plan summary, look at the description of the plan. It's important that you understand if you go take an MRI or an x ray, or if you just need to take some lab work that is not preventive, meaning it's because you have an illness, you need to take lab work every 4 months. That is not preventive. So, what may happen is you may end up paying part of your deductible and then some co insurance. So,
And
mm, go ahead.
and it's important right here for us to point out, this is the reason why you sit down with with someone like Aaliyah or I, because first of all, there's no cost to you for this. But understanding, if you just look it up yourself and you're like, oh, here's a zero premium, I could do this myself, I don't know what Carmen and Aaliyah is talking about. And then you realize, yes, you're going to have zero premium, but it doesn't matter what you're going to the doctor for. Now you have to satisfy a deductible of $8,000 or $5,000. These numbers are crazy. Sometimes it'll be $4,000, $5,000, $8,000 before you can before they will even start paying something. If we are looking for something and cost is important to you, or lower cost is important to you, we are still going to look for a plan that will support the fact that you need a lower cost, but also that that you can be seen without that deductible being first paid off, right? And
Yep.
that's something important. You got to look and see. You can find it in the plan summary, or in the details. But that's what we do for you. Once we look at the plan, we see $0. Oops, yeah, this might be good, but let me see what happens if you need to let me see what happens if you want to just go to the doctor because you got a cold. Do you have to pay your deductible first? Let me see what happens if you have to go into the hospital. Oh, $2,000 a night for you to go into the hospital. I am not kidding you. These are the kind of numbers that you see for the hospital. Let me see what it would be if you had to take an ambulance because of an emergency. You had to take an ambulance ride to the hospital. These are all the deductibles would actually put you in cardiac arrest.
You know what, Carmen? You're right. When I lived in Arizona, every time we turned on the news, it was somebody being airlifted from, people hike and they do all kinds of things and they get dehydrated. They call the air ambulance. Some companies will not pay for an air ambulance.
No.
And you have to be very careful. An ambulance ride is expensive in itself. And then I lived in a county that we had a separate ambulance service, and you had to pay. They didn't care about your insurance. And every time I would call the 911 from my husband because he did pass out, I would get an ambulance bill and a
Yeah.
fire department bill.
Yeah.
So there are counties that work like that. You just have to know where you live, know some of the rules, and know what happens with your insurance. Some of them, they don't care what kind of insurance that you have. When you call
Yeah.
an ambulance, that means you need some help now.
Yeah. And sometimes it's better for you to pay $50 a month, $75 a month, $100 a month. And then now that deductible is down to $500 a year, or
Hmm.
$600 a year, or twelve hundred
Hmm.
dollars a year. And now it makes sense, because what happens with some people is they have insurance, but they really can't use it on, they really can't use it because when they go to the doctor, they're like, well, this is not covered because you haven't met your deductible as yet,
Right,
and
right,
now you have to come out of pocket with $400. Well, that's not going to work for you when if you were like me and you were suffering from a vertigo attack, and you needed to go to vestibular therapy or something like that, and you need to get straight and but every time you go to vestibular therapy, even me with traditional insurance, every time that I went to vestibular therapy, they were like, oh, you got to pay $100 per visit because I have to satisfy the deductible before they start paying. Well, that's how sometimes some will let you pay toward that deductible. Some will say you cannot even be seen until you're finished paying the deductible. I mean, you can be seen, but you got to finish paying the deductible. So that is one of the most important reasons why you sit down with us, because we are able to say this is why this plan is not um what you think it is. Free ain't
right.
always free,
That's
right? And matter of fact, we will never tell you free. We will tell you it's a zero premium.
0%. Carmen, I also wanted to say one more thing. So, um, always, here's a tip. I'm going to give you a tip. When you go to the doctor's office, always say, "Can you bill me?" Bill me. Because if you have a plan that has a deductible or a high deductible with no copay or whatever, and it's the first bill in. So they submit a claim to the insurance company, and you've been to 5 doctors in the last 2 months. So the doctor that you gave your deductible to, which was $500, was the first doctor that you saw. But you saw some after that. Those are the ones that submitted the claims first. So theirs went to the deductible and the coinsurance, and this first doctor you went to submitted his last. Well, now you might have already paid the deductible, but you've given him your $500, and it's like pulling teeth trying to get the money back. I used to do
Yeah,
this all the time because it happened so often. They were late submitting the claim to the insurance company, so they might submit it 2 or 3 months later, whereas all the other ones I saw had already submitted, so they were going and racking up. And now I've given this man my money, and now it's like, give me my money back. It happened when I went
right.
to a chiropractor, and he still owes me $800
Yep. That that's
today.
something. Let me just tell you, like this year, so 2020, when the COVID broke out, first of all, a lot of people weren't going to the doctors, but one of the things that they were doing, you didn't have to necessarily meet the deductible that year. Some of the companies made it that way or whatever. Well,
Right.
guess what? COVID is not gone, but everything is kind of being back to normal. So I was sick. I was so sick. What was it, like 2 months ago? I was
I
so
remember.
sick. And I went to an urgent care, which, by the way, y'all, don't go to the emergency room. If you can go to an urgent care, go there first, because, but even there, right? I went, they didn't charge me anything. They thing, but now their bill came in, that's a couple $100. The bill came in from, um, someplace else I went to see, another couple $100, another, So now I'm like, if anything else happens, I want it to happen now, because next year that's gonna all start over.
That's right.
Next year,
That's
that's all gonna
right.
start over.
That's right. I am trying right now to get as many services as I can done before the 31st, but it is very difficult getting an appointment because
Yes, I just started.
those employers that have the flexible spending accounts. So you got to spend that money. You can use it or lose it on certain plans. So
Yeah,
they're trying to spend their funds before they lose them. And people have met their deductibles. I've actually met my out-of-pocket max. So when I go to the doctor, I don't have to pay anything. I have met that
right.
max. And that's why I say it's important to know what is your worst case scenario. Mine is a certain number, and I've met that certain number. I believe it was in June. So I'm still trying to get as many services as I can done before the end of the year, because now my deductible starts all over again January the 1st. And then preventive services, you have to make sure it's a year, at least more than a year, because you can't
Mhm.
just keep going. There's so many little things you have to watch out for. So we're here for you. We're here to help you guide you through the maze. Now, the maze is actually Medicare. We're going to get through Medicare in just a minute.
Yeah.
But under 65 insurance is a maze too, but we can help you with that.
And here's another quick tip. Do not deny yourself. Call us to see if where's your situation. Even if you looked up on at the 150% of the poverty level, if you're below that, um call us, because we can help you. You might be, and many people are like this, they're not making, someone has told them, you're not making enough, right?
Mhm.
You need to make between, sometimes some states, it could be 12 and $1,400 a month or something like that, or yeah. And they just decided they don't meet it. Call us, because there's lots of creative legal ways that you can get to that number that you need to get to, so that you get those credits. And the thing is, if you do something wrong, you're gonna be held accountable when you're trying to file your taxes. Now, it might not be the first year that you file your taxes that it comes back on you. It might not be the second year. It can be the third, it can be the seventh year. These people can come back. And now not only do you get hit for what you did, now you're getting penalties and fines and all sorts of things on top of that. So let
Right.
us help you. Don't tell the people that you're making less money just so you get the credit, because come tax time, that's something that's reconciled
Right,
again.
Carmen. You do taxes, so she knows. She knows.
Yeah.
Who does taxes?
So that's something that's reconciled. Also, don't decide, oh, I make $1,100 a month. We could tell you maybe you can pick up a babysitting job or something like that, so that you can make it to that 1,200. You just have to declare those wages and pay taxes on it.
Mm-hmm.
But now you would have gotten now you would have gotten the tax credits as well. And do not also decide, oh, I'm making too much in my business, right? Don't do that. Or I anticipate to make whatever. If you end up making a lot in your business, then great. You can pay for your health care. You can afford it. But it's whatever you anticipate to make for this year. We'll put that there, and they're not going to penalize you because you made more. They will penalize you, but you won't get in trouble for it because it was an estimate that you were doing. So please reach out to us. Aaliyah is licensed in all 50 states. I am licensed in not as many states, but I am licensed in a lot. But between the two of us, we can definitely get you taken care of. The other thing that Aaliyah is some of the states do their own marketplace insurance, their own coverage. Some states do that, and Aaliyah can still help you with that because she spends hours and hours and hours getting certified, not just for the federal marketplace like I did, getting for the federal marketplace, but then she also gets state certified for all the states that run their own. And a quick list of the states that run their own: California is one of them that runs their own, Colorado, Connecticut, District of Columbia, Idaho, Kentucky, Maine, Maryland, Massachusetts, Minnesota, Nevada, New Jersey, New Mexico, New York, Pennsylvania, Rhode Island, Vermont, and Washington. And she can help you in any of those states, even though they're state run their own. Me, not so much. Right. Because I am not doing I did not go ahead and certify in each of those states. It's enough that I certify in all those different states for Medicare, and then turn around and certify for the carriers as well. But Leah's the GOAT, and between her and I, we can definitely help you. We're going to switch now, right?
Yes. Now we're going to talk about
switch.
Huh?
Is there anything else we forget?
You think we went over enough on the under 65 though? Because we want to make sure.
If you have any other questions, we covered this in detail about 3 weeks ago. Go find that. That it's still on our live. It's still on our YouTube. Go find that, and we went into a lot more information. But it doesn't matter. Send us a comment, a question. Write a question on YouTube, on Facebook. DM us. We are here to help you, and making sure that you and your family are covered.
Right. Now we're going to get into the other open enrollment. And
we started before, right?
Oh, yes. That one started. So for Medicare. Now, how do you get Medicare? You get Medicare if you are, let's see. I know there are 4 ways to get Medicare. You have to be a U.S. citizen, number one, or you have to be a legal resident for 5 consecutive years. You're under 65 and disabled for at least 24 months, over 65, and you have end-stage renal disease, which is dialysis. There are dialysis centers cropping up everywhere.
Oh, yeah.
Or you have transplant or ALS, which is Lou Gehrig's disease. So those are the ways you can get Medicare.
And for the ALS and Lou Gehrig's, it's automatic. Like, you don't have to wait for 24 months.
And kidney failure too is the same. It's a couple months in there, but because dialysis is so expensive, they offer Medicare to those patients because it is a disease, or it is something that is very expensive. You sit in the chair for 3 days a week, normally 3 days a week, and you're there for at least 4 hours, getting your blood taken in and out of your body and clean, because your body is not filtering your blood. So that's very, very, it's scary, but it's life-saving treatment, and they want people to have it. So those are the ways to get Medicare. So open enrollment for Medicare started October the 15th. Okay. However, there are ways you can get Medicare, which I just said. And if you're already on Medicare and you, let's say you move somewhere and your plans are changing, things like that, then you can change plans. But for the most part, October the 15th, and it ends December the 7th. Who thought of this? I don't know.
I know.
Because
Why
it's
would
right
it even
for
at least go
Thanksgiving.
October 15th, December 15th? Well, I mean, why? But it is December the 7th.
December
And
7th.
so yeah, it's important that this is the time that you get to change your plan for no reason at all. You get to change your plan. And Medicare is not one and done, because things change. There are times you may love the plan that you have, but now some things have changed and it doesn't fit you anymore. So that's the reason to review with someone for Medicare. As a matter of fact, I would definitely get somebody to review my Medicare annually, and this is why. How many times when you were under 65 and you were working, um, they changed your plan at work? You love the plan was great. You love your doctors, you love whatever, but the company changed the plan. Why? They had it reviewed and it made sense for them to switch. It made an economical sense for them to switch. So for us as individuals, we have to treat our families like a business. We got to do what do I say? You want to be wealthy, do what the wealthy people do. The businesses make decisions based on their own interests. You got to make decisions based on your interests. So you might be on a plan that is doing this, doing that, whatever. But now there's a better plan. And you want to know something? Sometimes the better plan is with the same company that you have.
That's right.
It's with
Now,
this. It wouldn't switch your doctors. It wouldn't do whatever. It just gives you more benefits. Talk to someone.
talk to
Reach out
somebody.
and talk to someone.
Don't talk to Uncle Nipsey and cousin Billy, and because I'm going to tell you what happened to me today. I had a client that called me today, and so he already in his mind said, one of my friends said that I need to get something called a supplement. I said, okay, all right, that's good. Okay, so we'll talk about that. But in the meantime, I'm doing what I'm doing because with Medicare, you have to be very, very careful. As we get older, most people are on Medicare take medications. Most people that are under 65 and on Medicare take a lot of medications, and you're also disabled. So that means that there's a reason you got on Medicare. It's not the normal, I just turned 65, therefore give me what I'm due. They are under 65. So this guy was under 65. He would just turn 60. So he wants the Medicare supplement. So I go through and we have a presentation. We have to make sure we go through every part of it, and it's long. And so he said, okay, I gave him the price for the Medicare supplement and the price for the other thing. And he's like, well, I thought it was going to be free. What is going on? He could not believe it. He was so upset because the fallacy is when you get on Medicare, now you have arrived. You don't have to
Right.
pay medical insurance anymore.
It's not
That's not
true.
true.
Not true. Here's the thing, and Medicare is complicated for no reason at all. I got into this line of business, for lack of a better term. I was concentrating more on life insurance, and teaching people the value of that. However, when I saw I had to make a call to someone regarding something for Medicare, I think it was for my mom. And God bless this lady, Joanna. She sat down there and explained to me all these different things about Medicare. And when I realized how complicated it was, and that people need help. People don't think they need help, which is funny because we have to go through hours and hours and hours of training for the federal, for the, and for the state, and we have to go through hours and hours of training for every carrier that we represent. And people think that they could just make a choice, but there's so many nuances, and I hope that we can touch on some. So for example, I just got off the phone with a person who's considering starting their Medicare. Now they're 67, so they qualified for Medicare at age 65, and Medicare comes in two basic parts. There's Part A and Part B. Part A, you qualify for automatically if you have worked and paid into the system for 10 years or more. You can get that premium free. Otherwise than that, you have to pay for it, and it's expensive. Then Part B is a part that you have to opt into.
Oh, I think she's frozen. You're frozen, Carmen. So I'm going to finish what she was saying. Hopefully, everybody can hear me. Um, Part B is what you have to opt into. So when you turn 65, if you've worked to 40 quarters, then you get Part A for free. And that is part is the hospitalization part. Part B is what you have to pay for, unless your income is in a guideline in that where you get a low income subsidy. So we won't go into that. But for the most part, most people are going to pay for Part B. I'm going to text Carmen really quick and just let her know she's frozen. I don't think she knows. But while I'm texting her, I'm just going to tell you. So Part B premium for 2020, let's see, 2022 was $170.10. And so people don't understand. Carmen's coming back, so I'm going to let her finish this. But Part B, the premium is 170.10 for 2022. So if you don't know that and you think it's free, Carmen, I'm going to let you finish talking about that because you're still circling up there.
I know my internet. I don't know what happened. Now there's two of me.
I know.
I don't even know which one to remove.
You know what? It's okay.
Can
Long
you
as
hear
you
me?
can talk. Yeah, I can hear
Okay,
you.
Kim. Okay, so where I was talking about Part B.
Part B.
Right. And so Part B is not premium free. This year it's 170.10. And if you were a high income earner, it can be even more. So if you made over, I think for a single person it's like $180,000 or more, you would have to pay an additional amount just because you made more money during your working years.
Right.
Some people, but most people fall in where they would pay 170.10. Here's the good news: next year it's going down. It's going to be 164.90.
Right. Right.
You're going to save a whopping what, $5.10? I don't know, but so hey, Nurse Gina. But so you have to pay for a Part B. So here was the here's one thing. So she turned 65. When you are working in a job that was it greater than 50 people?
20. 20.
Greater than 20 people,
Mm-hmm.
then you do not have to switch to Medicare when you become Medicare age. You don't have to. But if you are working a job with less than 20 people, you do. And this is why it is complicated, because how is some regular person supposed to know that? Because here's the thing. There's a whole lot of things going on, but you have to have what is called credible coverage between ages 65 when you're supposed to join and whenever you join. Otherwise, you face a penalty. So if you are working in a big corporation that's providing um, um, medical insurance and drug insurance that at least that meets the minimum requirements of Medicare, then you're good. And now you can keep working until whenever you feel like it, right? till you're age 71 or whatever. And whenever that happens, now you have a special enrollment period to enroll in Medicare. So that's what happened to my client that I was talking to today. She's 67, and she was like, I'm still gonna work, but I want to know. But she was listening to us, and I want to know, is it does it make sense for me to switch, or do I should still stay on my job? So here's the thing: look, and you got to do a comparison. What are you paying out? So as she looked at what she was paying out, right? Even though she's pretty healthy, so she chose that high deductible and this and that, whatever. She was paying out over $4,000 a year. And still, when she goes to the doctor, she had to make payments. It made sense for her. It makes sense for her to switch, pay her Part B premium, pay her supplement, a Medicare supplement, and now she's going to pay less than she was paying overall. And even if though she pays that $200, it's $233 this year, I think it's going down next year to a little bit less. She still would pay less, and whenever she goes to the doctor, she would never pay a dime.
Right.
So but listen to that. You got to make a whole bunch of complications. Am I working for somebody that has enough credible coverage? Is it less than 20? Is it over 20? How much am I paying out? How much do I pay when I go to the doctors and actually do the procedures? How much, should I do a Medicare Advantage then? It is so complicated. But for her, we chose a supplement that will pay basically everything for that 20%, and plus her deductible. Now she knows that she's not going to pay over $4,000 a year ever, and she won't have to pay anything else. She still did have to get a Part D though. Part D is drugs, and you have to have a Part D coverage even if you don't take any medications, because when things change and you do need medications, now you're penalized because you did not enroll when you were supposed to be enrolled, and they penalize you for every single year that you should have had it, 10% for every single year that you should have had it that you didn't have it. Now do you see why it's important that you and your mom and your dad, your auntie, your uncle, and everybody talk to Aaliyah and I?
Right. And then, Carmen, I wanted also to point out the plan supplement that you're talking about. So that Medicare supplement has a monthly premium.
Right.
So she's paying her monthly premium, her Part B premium, and she has to pay the deductible for, is it Plan G?
Yes, Plan G.
So she has the deductible of her Part B, but then she pays nothing else.
Yes. And that's right. And that's why it was important, because we talked about it. We said, listen, you could pay $0 every single month, right? You can go ahead and get a plan that has a zero premium. And so now at the end of the year, you can say, oh, look, see, I saved my $2,000. But if something happens now you're at, and wait, one more thing I should just make clear before this. I said, rewind. I said that Part A and Part B, which is the original part of Medicare, is basically an 80-20 plan. And I think I said that before. But what I want you to understand, they pay 80%, you pay 20%. And although that doesn't sound like a lot, if it's $100 bill, you pay $20, that's cool. When that bill is $100,000, now you have $20,000 that you have to pay. And those are not big numbers we're making up. These are realistic numbers of things that you can face. So what you need to understand, that 20% is 20% of infinity. It could go as high as ever. So most people use something to protect them on that 20%. Mm-hmm. And there are only two ways to do it. One is with a Medicare supplement plan or Medigap. You might hear people say MedSup or Medigap. Two is with a Medicare Advantage plan.
Mm-hmm.
When a Medicare sup or a Med sup or Medigap plan, the only thing you're covering is just that 20% part of it.
Right.
Okay, the original Medicare still covers the other 80%. When you go to a Medicare Advantage plan now, you have basically replaced the Medicare Part A and Part B with your Part C, your Medicare Advantage plan, and they're managing everything.
Right.
So you got to look at your situation and see.
Right.
Because remember, with the Med Sub plan, you still got to get a drug plan. Many times it's not that expensive, but you got to be careful of those deductibles that comes in the beginning of it. Second of all, you got to be careful. You got to remember that there's no eye, air, dental. All those things are not covered on the original Medicare, and that's where Medicare Advantage Part C sometimes gives all those extra benefits that they're talking about on television. So now you got to weigh which is better, right? You got to weigh which is better. And I'm gonna give you a quick story, Aaliyah, of a client that I had who was already in trouble by the time she decided to retire. She was going great, nothing was wrong. She was still working past 68, 69,
Uh-huh.
and she suffered a stroke.
Oh.
So now she had to retire. So now her bills going forward on a Medicare Advantage plan, she would most likely meet that maximum out of pocket. Some of them go from $6,000, $7,000, $8,000, $10,000, $11,000. So she would most likely be looking at that maximum out of pocket should she choose a Medicare Advantage plan. Should she
Wow.
choose a supplement, she might more look like paying just $2,000 a year. So for her, it's important that she chose the supplement plan at this time, figure out how she can afford that to prevent her from even having to go higher, even though there's a max, but it can prevent her from doing that. It's important for her to do that, right? So
Absolutely.
it all depends on what is going on. And it's not like you can't ever get a supplement again at age 65 or whenever you retire, whenever you get Part B, it's guaranteed issue. The government says, we don't care what she has. She could have a stroke. She could be almost dead. You have to take her. Guaranteed issue. But if you do not take it during that guarantee issue period, now you have to be underwritten and they're not going to take you. And now you will have no choice but to take a Medicare Advantage plan and know that if you were in that client's position, that you would have to at least come out of your pocket $10,000, 5,000, whatever that maximum out
Right.
of pocket is.
Right. Now, one thing, remember I was telling you about the client that I talked to. He was under 65,
Right.
but his friend or cousin or someone said, "No, don't you get a supplement. Get a Medicare supplement plan." And so I talked to them because when you're under 65, the Medicare supplement rates are higher than if you were 65.
Because they know you're disabled
Right.
already.
And so this cousin doesn't know that,
Right.
and they're giving the person advice thinking that, you know what, if you don't get the Medicare supplement plan, because this is what you need, and it may be very well be what you need, but he can't afford it. I've had two of those the last couple of days. They're both like sick. One was 60, one was 62, cancer problems, issues, both of them. And a Medicare supplement is actually the way to go for both of them. But they started off at like 250 each for a plan G, and that's each. Plus, they need a Part D, and the medications that they're taking are super, super, super expensive. And so when you get on Medicare, it's a fallacy again that everything is going to be lower. It's not. It may be if you're Medicaid eligible or something like that, then that's a different story. But if you are under 65 and you're on Medicare, And you do need a Medicare supplement if you are extremely ill. That way you can go to the Mayo Clinic. You can go to the cancer treatment centers because you have a Medicare supplement. You can go to Stanford University or something like that that takes Medicare, but you have to have a Medicare supplement. So these are the things us as agents help you with. Don't listen to that cousin or something because they
And
don't
that
know.
right. And the other thing is those people will give you advice and share whatever, but they don't tell you the whole story. Now, they might be they if you are, regardless if you're on a supplement or you're on an advantage plan, you cannot cancel your part B. You still have to pay for part B. Now you might have your cousin and them whoever that doesn't have to pay their part B because they qualify for Medicaid or something, and the state is paying their part B. So now they come and tell you, "Oh no, it's free. I don't have to pay it." And you are like, "Well, I'm just going to cancel mine." Now, once you've canceled yours, that's it. You've canceled everything because you can only get a Medicare Advantage plan if you have Part A and Part B. You
Right.
can only get a Med Sup plan if you have Part A and Part B. That's the only way. So you can never cancel your Part B. Now, some companies in some zip codes, hey Gina, some companies in some zip codes may have a give back plan, meaning they give back some money on your Part B. Is that right for you? Maybe, maybe not, because they give with one hand and take away with another. They give big bright apple with the right hand and they take away something with another. Understand that many times when there's a give back, there's something else that's being cut back. So it all depends on what you need. You may have another dental plan, so you do not need all the dental. And on this company that's doing a give back, the dental might be less. Or they may be giving a give back, but there's no transportation and you can't drive. You can't afford to have no give back because you need to drive to the doctor. So a give back is not necessarily for you. It's based on your circumstance. So when the TV is speaking to you as if it is speaking to everybody, they're not. They're just trying to get your number.
Oh.
I I don't know if it's my aunt because to say hey niece, but hey auntie. But you never know. You never know what is if it's really for you. That's why you speak with us, because if it's important for you to get a ride to your doctor because you do not drive, if it's important for you to have more money going toward your dental, also your specialist may be even more expensive, right? It's now $45 or so to go to the specialist when you were paying 30.
There's so many variables, Carmen. We could
So
sit here
many.
all day and talk about the stories that people come with to us with because Uncle Nipsey or somebody told them, I got this plan and it cost me nothing. Well, he didn't tell you he was on Medicaid.
Right. Exactly. So, it's different, right? And if you happen to be dual eligible, reach out to us. We
Right.
will look at your situation, look at your zip code, and see what plan is better for you. Because when you're dual eligible, that means that you get a little bit more help, and there's certain things that could be important to you. They give other I'm not going to go into specifics of plans, but most of the times when I get a call or whatever, hey, I want that give back and I want that flex card. I was in the supermarket a couple of days ago with my granddaughter because we are going to be making black cake, which is a traditional cake for Christmas in Guyana, right?
What's it
It's
called?
other places. It's called black cake. Some people might
Black
call
cake.
it rum cake. So it's made
Oh,
with
okay.
lots of fruits and stuff like that. We have to soak the fruits in. Many Guyanese people soak those fruits up for months and
Like a
years.
fruit cake?
in a fruit cake. Yes,
Okay.
yes. It's a black cake, fruit cake. So my granddaughter and I went to the store to do that. And I was talking to someone. This lady said, she tapped me. She said, I need to ask you something about Medicare. I said, okay. She said, hold on, wait for me. And when I got, she said, you know anything about that flex card? And I said, yes. I said, yes. This was like, this was like my granddaughter's calling me. She went to the emergency room. So I'm gonna tell her that I'm calling. I'll have to call her back. I'm gonna call
We're
you
way
right
over
back,
our
Shirley.
time too.
Huh?
We're way over our time.
Okay, baby girl. I'm gonna call you right back. She said she had to go to the emergency room because she needed an X-ray or something because something is hurting and she could hardly whatever. But so she said, but y'all, it's not like I'm an uncaring grandma. She's good. She just she just needed. I told her to call me back, and I didn't not want to answer and let her know that I'm gonna talk to her in a minute. She was not in any much distress, but she was having the pain. Though this is the same granddaughter that tricked me around Halloween with blood, talking about she's cut and she just had fake blood.
Oh my goodness.
And she's only 8. But wait till I get her. But now here's the old age moment. I totally forgot what I was talking about.
You were talking about the lady came to you with the flex.
Oh yeah. So she was like, yeah, come on, come here, tell me about this thing. So I said, yeah, I know about a flex card. She was like, I just want to know, is it going to affect our Social Security? Are they going to take it back out of our Social Security? And are we gonna, or is it going to affect our taxes? And I said, no, that's just the company offering. They're all trying to, get clients, and it's just giving one company a competitive advantage over another, but most of them are doing the same things. She was like, oh, okay. I said, but go ahead and give me a call so that I can review for you. She goes, oh, it's not for me, it's for my husband.
Well, that's good. But we're way over time. So we're going to have to wrap it up. This has been fun. I tell you, when we start talking about health insurance, it's my passion. Life insurance, I love it too. But health insurance, it's my passion. I just believe in it.
Yeah, I hear you, girl. And I'm going to tell you this right now. First of all, we are out of time only because this is time constraints that we put on ourselves. We could be live for however long we want. However, we have decided that we will just do it for an hour. But listen, once again, if you have any questions, please reach out to us. Please inbox us. Please, we can be reached at millionaireLadiesMob@gmail.com, or just go to millionaireLadiesMob.com and you can click on either of us that you want to connect with.
Right. And also make sure you go to our YouTube channel. We're trying to get everybody on that YouTube channel, millionaireLadiesMob.com. Look at the videos. We've got 30 some videos that we've done in the last few months. I didn't realize that. And so just go. There's information for everybody. We're going to be talking about all kinds of things: how to create millionaire babies, how to create millionaire kids, adults, and how to retire. We're going to be talking about all kinds of stuff. And so what I want you to do is go to YouTube, subscribe to our channel, follow us on Instagram, follow us on Facebook, and then join our group so we can talk to you and you can gain some knowledge, and we'll follow you back. I follow a lot of people. So again, thank you so much for joining us Thursday evenings. It's 5:30 here, or it was 5:30, and it's dark. It used to be really light. I hate that. Time changes.
I know this is a different kind of turn back the clock, man.
I know.
9 o'clock. It's at 6 o'clock. It feels like 9 p.m. now.
I know. So we thank you guys for joining us, and we're gonna say good night, everyone. Thank you.
Good night. Thank you so much. This was awesome.